Everyone across the U.S. has been affected by coronavirus in some way, shape, or form. Last October, a positive COVID test put me in isolation for 10 days. While it was nice to get a break from reality, the physical as well as the mental effects came into play, making it much more serious. Today, I will be informing you all about how the nation has been affected by coronavirus, more specifically, how it has affected people's mental health, physical health, and the economy. Almost exactly a year ago, coronavirus took a toll in the U.S. Numbers spiked dramatically, and the stay-at-home order came underway. According to NBC at the time, the vast majority of states have officially ordered most residents to stay indoors, except for essential workers or in specific circumstances, and hardest hit, New York. While many prospered through this time of rest, taking up new hobbies such as painting, reading, or walks with family, others suffered from the seclusion. The World Health Organization created a survey called WHO in regard to people's mental health during the pandemic. They found that bereavement, isolation, loss of income, and fear are triggering mental health conditions or exacerbating existing ones. Many people may be facing increased levels of alcohol and drug use, insomnia, and anxiety. Meanwhile, COVID-19 itself can lead to neurological and mental complications such as delirium, agitation, and stroke. People with pre-existing mental, neurological, or substance use disorders are also more vulnerable to COVID-19 infection. They may stand a higher risk of severe outcomes and even death. This calls on countries to provide better healthcare for our people in need, for those suffering in quarantine alone, those who have lost loved ones, and those who are scared of what is to come. The cautions taken through nationwide lockdowns also had a colossal impact on the economy. According to BBC, the FTSE, Dow Jones Industrial Average, and the Nikkei all saw huge falls as the number of COVID-19 cases grew in the first months of crisis. You can see here in this handy-dandy chart the impact of coronavirus on stock market since the start of the outbreak. We can see a huge downfall as the coronavirus begins to take place in the U.S. The immense decline that occurred last February only recently leveling out to normalcy as businesses began reopening. Yet some companies could not withstand the downfall, with more than 98,000 businesses shut down permanently. While stock market rates have gone down, unemployment rates have increased. With 3.7% in 2019, the number has spiked to a staggering 8.9% in the U.S., according to the IMF. When walking into most facilities, you'll hear workers using thermometers and repeating the same question. Have you experienced any of these symptoms in the last 10 days? Shortness of breath, chest pain, fever, cough, loss of taste or smell? While these are the most common symptoms of one who has COVID-19, others have been asymptomatic. This illness has sent many to the hospital and led to a traumatic number of deaths across the world. There have been nearly 28 million reported cases, with 494,000 deaths. The CDC states that adults of any age with certain underlying medical conditions are at an increased risk for severe illness from the virus. Yet there is hope as vaccines have been made readily available to the public, already currently being given out to healthcare workers and the elderly. The CDC says that the vaccine will teach your immune system how to recognize and fight the virus that causes COVID-19. In all, the effects of coronavirus has had on people's mental health, physical health, and the economy have been unremarkably terrible in the U.S. Yet with an economic incline and vaccines, we are starting to see the horizon of normalcy once again. Thank you.